Hi, everybody. My name is Daniel, and I'm a physician assistant, and I want to welcome you to Physician Assistant Street. And these are some of the things that we use as a physician assistant. And today, our session is on how to maintain a healthy lifestyle. So let's get started.
Street. Our discussion today is how to improve compliance of hospitalized patients. Patients should know which provider he/she is interacting with. When a patient is admitted to the hospital, the patient is admitted to the service of a physician as written in his admission order. However, it takes a whole health management team of nurses, patient care technicians, physical therapists, respiratory therapists, dietitians, occupational therapists, case managers, social workers, physician assistants, nurse practitioner, and etc. for proper management and care of the patient in the hospital. Even the cleaning person who cleans the patient's room is involved in the patient's care. There are many instances where it was the cleaning person who informed the patient's nurse of a change in the person's health status. Providers should know patient should know which provider he/she is interacting with. In this maze of various interaction with different providers during the course of a day, the patient hears different things from different providers, and sometimes they differ and even conflict with what other providers stated to the patient. These different interactions with multiple providers of different medical services can be confusing to the patient if he does not know what capacity the provider is acting under. Some providers will identify themselves to the patient when they are first interacting with the patient. Some, in their rush to finish their patient load on time, might forget to do so. Most hospital care providers dress in hospital scrubs or lab coats, so it is very hard to differentiate one provider from another unless they introduce themselves and tell the patient what they do. Patients should know which provider he/she is interacting with. Hospitals have recently taken steps to cut down on this confusion based on patient feedbacks and concerns. One step that they have taken is to issue another badge in addition to the provider's ID badge. That badge has the notation of RN, PCT, PTOT, RRT, PA-C, ARNP, MD, or DO to designate the provider's role in the health management team. Hospitals have also started to have different members of their staff dress in different color scrubs to make identification of staff providers' role more clearly to the patient. RNs are dressed in dark blue scrubs. PCTs, patient care technicians, in burgundy scrubs. Physical therapists in black scrubs. Respiratory therapists in light blue scrubs, and so on. However, physicians are not employee of the hospital, so the hospital cannot dictate to what the physician wants to wear. Providers should know which Patients should know which provider he/she is interacting with. The patient also interacts with different physicians such as internal medicine, cardiologists, pulmonologists, infectious disease, urologists, and others. Physicians who are the most important provider in the healthcare management team of the patient should make an effort to properly introduce themselves to the patient and what capacity or specialty he/she is working in the healthcare management team. When the patient knows which provider he is interacting with, he also knows who to seek information from about his various health concerns. This also assists the patient to make more informed decisions about his healthcare options and treatments. Use common everyday language to improve patients' understanding. Providers should use common language terms and minimize use of technical terms and abbreviation to facilitate better patient understanding of provider communications. Providers are used to using abbreviations such as non-STEMI, ROM, COPD, CHF, GERD, DM, HCN, and etc. to communicate non-ST elevated myocardial infarction, ROM for range of motion, COPD for chronic obstructive pulmonary disease, CHF for congestive heart failure, GERD for gastroesophageal reflux disease, DM for diabetes mellitus, and HTN for hypertension. Abbreviations can be confusing even for those in the healthcare field. Under normal circumstances, ROM would stand for range of motion. But in the context of OBGYN, ROM means rupture membrane. Who knows? Use common everyday language to improve patients' understanding. Patients' educational level and experience in the healthcare environment also contribute to the patient's understanding of medical terminology and abbreviations. For patients with higher education level and those who have experience in the field, understanding medical terms and abbreviation will come easier for them than someone with a lower educational level and less exposure to the medical environment. The availability of information on the internet can also increase the patient's awareness of medical terminology for those who use the internet. It is best to use common everyday language so everyone can understand. Use common everyday language to improve patients' understanding. Unfortunately, under the current medical working environment, physicians have a limited amount of time to spend with each patient. When patients understand providers' communications completely the first time, it decreases the amount of time and effort required for the physician to repeat and explain that information to the patient. It is also better for the patient because sometimes patients feel ashamed of themselves when they don't understand what their physicians are communicating to them, or are less inclined to ask questions because of that. Improve patients' mental, emotional, or stressful conditions. Usually when a patient is admitted to the hospital, the patient is experiencing a health problem. Patients go to the hospital to seek medical attention when they have pain, fever, chest pain, shortness of breath, urinary retention, seizures, injuries, or some other deficits or issues. This is a stressful situation for the patient because the patient is in various degree of discomfort or pain, and he does not know what is going on with his body. The most important questions in the patient's mind is, what is wrong with him? What would the hospital do to help him with his medical issues, and how long would it take? Improve patients' mental, emotional, and stressful conditions. The most pressing concerns are what can be done to relieve his pain and what is going on with his body. Will it incur long-term damage or even death from this medical condition? The first issue to address is to decrease the patient's stress by alleviating the patient's pain or discomfort. This would include pain medication for pain management, Foley for urinary retention, oxygen and respiratory treatment for shortness of breath, and any other medical intervention to relieve the patient's discomfort. This shows to the patient that something is being done for him and that the hospital have the best interests of the patient in mind. Improve patients' mental, emotional, and stressful conditions. Another issue to address is to explain what is affecting the patient and what can be done to help them. Take time to explain the results of labs and diagnostic screens to the patient in a way that he understands. Explain options, possible interventions, and possible outcome of those interventions. Patient will always have the right to refuse any intervention or to have nothing done at all. Explanations of possible outcomes if no interventions are carried out should also be included for informed consent and decision-making by the patient. Improve patients' mental and stressful conditions. Patients should have complete information before they make a decision about medical treatment. It gives the patient comfort that he controls what is being done to his body. Always be truthful and to the point when speaking to the patient. As a healthcare provider, you can only use evidence-based medicine based on current technology, methodology, and resources available at the time. Relieve patients' mental, emotional, or stressful conditions. Make sure the patient understands that no one can guarantee outcomes or promise certain results. There are variables and risks involved with any intervention. Some intervention might work for one patient, might not work for another. Patient under different circumstances. The more the patient knows about what's going on with his body and what can be done about it, the more control he feels he has with his body. When the patient's mental and emotional well-being improves, that patient's cooperation and compliance will also improve. This facilitates a better hospital experience and shorter hospital stay. Break down barriers to patient-provider communication process. If the patient speaks in a language other than English, then effort should be made to get a translator or a staff member that speaks the patient's language to interpret what the provider has to communicate to the patient. For example, in Miami, in addition to English, the other prevalent languages are Spanish and Creole. Because a large percentage of the population speaks these languages. It will be easy to find a staff member who speaks these languages who can translate for the patient. Many hospitals also have translation services by telephone. Break down barrier to the patient-provider communication process. Always ask the person if he has any questions about what have been communicated to him to make sure he understands. Many hospitals have personnel who are especially trained to provide education such as diabetic teaching to the newly diagnosed diabetic patient or breastfeeding courses for the new mother. Hospital can also provide informational brochures on certain health issues and treatments. Use these resources to educate the patient so they can make informed decisions and take charge of their lives and their illness. Provide complete information on the patient's status and treatment options. Provide complete information on the patient's health status, issues affecting his health, and his medical and surgical options for treatment. Explain the results of labs and diagnostic scans and options available to correct abnormalities. Explain the medication that the patient has to take to maintain his health status and the reasons to make adjustments to the patient's medication if needed to maintain the patient's optimal health status. Allow for patient feedback. Always allow for patient feedback and address any concern that the patient might have once she has been informed of his or her health issues. This ensures that the patient understands the issues and problems that he has to address and the options available to him. This also makes the patient feel that his opinion is important and that he is involved in an active participant in his care and treatment. Patient wants to be heard. Make sure the patient has the option to seek out a second opinion. Make sure the patient is aware that he has the option of seeking a second opinion to assist him in making a more informed decision on the options available to him. Most people are afraid to make decisions based on things that they do not understand, especially when it involves their health. They like to know that they're making the correct decision. It is their body involved and it's the only body they have, so they have to take good care of it. Provide printed material to increase retention of important information. Provide printed material whenever possible to improve patient understanding and increase retention of important information. Most hospitals have computer programs within the patient's e-chart program that could print out informative data on disease, medication, treatment, and surgical procedures that can be explained in depth to the patient with pictures and terms that the patient can understand. Patients are usually given those information sheets upon discharge, but those information sheets can also be given to the patient while they are still hospitalized in the hospital. Respect the opinion of other healthcare providers. Always listen to and respect the opinion of other healthcare provider team members in the health management team of the patient. Discussion among providers allow for the opportunity of pooling intellectual resources and reducing the risk of important items being overlooked in the patient's treatment. In healthcare, you want the highest trained provider treating the patient. Specialists should be called when complex issues arise to ensure that you have the patient with the highest training, expertise, and experience addressing the patient's complex medical issues. Patients should understand that there are limitations to technology. Ensure that the patient understands the limitation of current available medical technology so the patient does not have unrealistic expectations on what can and cannot be done to treat his medical issues. As always, begin with the least intrusive treatment first, and with each intervention, the benefits should always outweigh the risk before undertaking the intervention. No one can promise a positive outcome. We can only hope for the best, but we have to prepare for the worst. Follow-up is a necessity. Always follow up with the patient after discharge to ensure that the patient is taking his medication as prescribed, following diet and activity recommendations as instructed, and to follow up with his primary care provider to monitor and to ensure that his healthcare needs are being met. Once a person acquires a chronic illness, that illness has to be monitored and treatment adhered to in order to keep that illness in check so it does not overwhelm the body and cause that body to die. All life is precious and should not be wasted. Live a healthy life as long as you can. The natural order of a living organism is The organism is born, the organism grows up, the organism grows old, the organism acquires sickness, and the organism dies. We want to put off the dying part as long as we can. To achieve that, we have to maintain a healthy diet, maintain a minimum activity level, and avoid unnecessary risks in our lives. However, when a person does acquire a chronic illness as part of the aging process and needs medication to treat that illness, one should be proactive with their health and accept the fact that the medication regimen is part of their life, and he always be compliant with his medication to maintain his health status and avoid deterioration of his health. Pearls to live by. Always live by the golden rule. Treat others the way you want to be treated. Hope for the best, but prepare for the worst. Life is not easy, but it's better than the alternative. Tomorrow is another day. Always do the right thing so you can sleep at night. No pain, no gain. You only have to answer to yourself. You can't fight Mother Nature. Live long and prosperous. So that's it for this session. Live long and prosperous. This is Daniel C. Yang, and this is Physician Assistant Street. Thank you.